Hey Woodlawn team, we're here to talk today about periodontal disease, right? Periodontal gum disease. So this is a common thing that happens in hygiene. This is also a common misconception with patients about what they're supposed to do, why they shouldn't ignore it, those kind of things. So we're here to help clear that up with the lovely help of Megan, our expert right here. So, first thing we do is periodontal charting with the patient. So, what is the criteria for periodontal disease and the easy way to explain that to a patient?
So periodontal disease or gum disease is a bacterial infection of the gums that causes deeper pockets to start around the teeth. 4 millimeters or greater pocket depths are common with gum disease, as well as bleeding and bone loss on the x-rays. Whereas healthy gums should only be 1, 2, or 3 millimeters at the most, no bleeding, no bone loss.
Okay, see, that's awesome. I didn't even know all the way what's the exact criteria. I mean, it's a real easy way to say it. Plus, people are often, they come, they're like, well, are my gums supposed to bleed every time I brush my teeth? Like, I thought that was normal,
Or they say, well, yeah, they're bleeding, you're poking them. Well, an easy solution for that would be, this is a dental probe. It's like a rounded ruler. We're taking measurements. If I touch it to my finger's not going to bleed.
Right.
So healthy tissue does not bleed. So
That's
that's
an awesome
another good way
put
to
it.
explain it.
Yeah, it's like, dude, I'm just taking a ballpoint pen and, hitting your skin. Like, you shouldn't bleed from that.
Exactly.
Right. Patients that are either new to a dentist or they've been established somewhere else, sometimes even for years, and it's just like the first time they've ever heard that they've had periodontal disease. So why is this news something that a patient shouldn't ignore, in your opinion, Megan?
If left untreated, the infection in the gum tissue will cause bleeding, bad breath, bone loss, and eventually tooth loss if it gets severe enough. A lot of patients don't realize that. They think, oh, my gums have always bled, that's normal. They may not realize that healthy gums don't bleed. So we just need to educate them that if you see bleeding, if you notice an odor or a bad breath, or a loved one tells you, your breath isn't as fresh as it could be, that can definitely be a sign that there's more going on than you may realize.
Definitely. So this could be very well be new news to them, but when Scheduling Institute talks about, do you emphasize what to gain or what to lose? This is the thing, is what to lose. Like, these people at this point, they just realized, or maybe first heard, that you're losing right now, right? So, and that's something that we don't need to really brush over. We just have to let them know that this is bad. You can't just ignore it, right? But later on, just a little while in the conversation, we're going to provide that we could do something about it. So that will come for later, but they need to know how important that it is, because sometimes patients, they hear that and they're like, okay. And as later on they'll come in and we'll be like, well, aren't we, gonna do cleaning? But we'll get to that. After the news of hearing about periodontal disease and that it's active, that it causes destruction, you still get hit with the, why can't I get a regular cleaning? Or they get in a consult and they're like, how come I didn't get a regular cleaning? Why can't they get a regular cleaning, Megan?
Well, when you have gum disease, the infection is down in the gums below the gum line. When we do a regular cleaning, it will not treat that infection because we're only cleaning the visible surfaces of the teeth above the gums. If you have that infection, that bacteria, those toxins are down under the gums, below the gum line. So when we do a regular cleaning, it's going to actually trap those embedded toxins under the gums, and it can actually cause periodontal abscesses to form, which we don't want that, and the patient definitely does not want that to happen.
Definitely. So, one thing, just wanted to add, Dr. Maximo was talking the other day, and, he was explaining that, when you look at your tooth is like, it's like a barren rock, right? So it's like, cavities, tartar, those are infectious things growing on a barren rock, right? Like, periodontal disease, like you're in a lush forest, you're in the gums, down in the gums where, all the blood exchange happens, where it could go to the rest of your body, just all the good food that bad bacteria can have, like it's all right there for the taking. It's not growing on a barren rock, it's growing in the rainforest, right? It's like you have an active infection growing in a rainforest, right? Another thing is, people think of infections. Infections could either be local or they have the ability to become what's called systemic. So why is this not a local infection or just to that place infection?
Right. So because there are so many blood vessels in the mouth and in the gums, that bacteria will travel throughout your bloodstream. It will travel throughout your body, and it will affect all of your organs. It will affect all of your body parts. So it can contribute to heart disease, diabetes, erectile dysfunction in men, stroke, low birth weight babies. There's various things that it can affect systemically, not just in the mouth.
All right. Okay. So that's great information. So another thing, diseases that she mentioned here: heart disease, diabetes, ED, stroke. These are all like what's called, these are comorbidities. So these are things that, genetics plays a little bit of a role in it too. But there's things that you do every day of your life that contribute to having these. So these things can be somewhat reversible, especially when you talk about heart disease and diabetes. So it's like they're just making it hard on themselves. Mm-hmm. And this is one thing that if they take care of it and they do what we'll talk about later, the things at home, they can put themselves in a heck of a lot better position than they are, especially when it comes to heart disease and diabetes, which,
absolutely.
I mean, that's just like, those are man-made diseases, type 2 and, heart disease for the most part, so.
And I know I've had several patients, for sure, especially diabetic patients, that when their gums are in a healthier state, their blood sugars are better and easier to control, and vice versa. If their blood sugars get out of whack and get really super high, then we also see an increase in their bleeding and their inflammation as well.
Okay, so now, you talk about the travel, so the infection obviously leads to inflammation. People may not all the way understand the whole, like, your body just fighting inflammatory processes just isn't good in general.
Right.
But what's another thing that gets in there that travels around that maybe they would, like, put a link to?
Like the plaque.
Yeah.
Mm-hmm.
So, like, what about the plaque? Like, what could you say to someone that has, like, heart disease or
so
stroke risk, those kind of things?
That plaque gets into the bloodstream as well, and then it can clog, blood vessels in the heart, in the brain, and those can cause, heart attacks, strokes.
Right. So that plaque is just,
traveling throughout the
it's just traveling throughout the body. It's the plaque that we talk about when it comes to, heart attack kind of things, stroke kind of things.
Absolutely.
Cool. All right. Okay. Another question that you'll get from patients on the treatment coordinating side is a little bit of confusion about what's the process to be able to take care and maintain this disease. Mm-hmm. So what is that process, Megan?
So the initial gum treatment is what we do to remove the embedded toxins below the gum line, down in those deeper pockets. We want to do that as soon as possible to get that bacteria out, to stop that infection. We can't, once you have bone loss, you can't bring that bone level back. Once it's gone, it's gone. But we can help to stop the infection and to maintain the bone levels that we have currently. After that initial treatment, we bring the patient back in about 6 weeks, where we want to reevaluate the gum health, to check the probe readings to see how deep the pockets are. We'll also do a maintenance appointment to remove any remaining toxins that are under the gum line. After that, 3-month maintenance is necessary to maintain the gum health and that bacteria long term.
Okay. All right. So that's so the big thing is the first thing, and then 6 weeks after, we're going to reevaluate the progress of that. Do some spot kind of things to see what came up again, basically, right? Then after that, you're just on your 3-month schedule as maintenance, as opposed to if you're healthy, like if you didn't have periodontal disease and you can have cleanings, instead of 6 months, it's 3 months, right? Okay.
Right, correct.
All right. So it's I mean, in these bullet points, we're just going down them. It's very clearly explained as well, but definitely something that the patient needs to understand that when they're sitting in the chair. All right. So a good way to do that is just to review it with them and then have them say it back to you so that they understand that. Because that's a big question that you get. They'll treat it as it's just, I don't just do it one time and then go back to my old thing. It's just, they don't all the way understand that. Ready?
Good.
All right. Now, like we say with other things, but we definitely need to really emphasize here is there's things at home that you have to do to play your part in the success of these treatments. We're not asking for an arm and a leg, just a few minutes of commitment. So what are those things, Megan?
The home care is vital to control the bacteria that causes the gum disease and prevent, future relapse of that infection. So things that need to be done at home on a daily basis are the use of an antibacterial rinse once a day. So that would either be our alcohol-free chlorhexidine rinse or OxyFresh. Both do a great job at controlling that bacteria. Also the use of a high fluoride prescription strength toothpaste like our ClinPro that we have here. We should remember from past trainings that fluoride not only helps prevent cavities on the root surfaces that are exposed in a lot of patients with periodontal disease. It's going to help with sensitivity. It's antibacterial. And it helps to remineralize the enamel as well. So it's vital for long-term prevention of future issues. And then either flossing or water pick daily is so important to clean down in between the gums, in between the teeth, to get those toxins out from in between the teeth and around the gum tissue.
All right. So just to review here, because people are like, I gotta do all this stuff. It's like, dude, all you have to do is floss, right? Like, take a minute and floss. Or get a water pick and press a button and put it close to your teeth, right? Not very hard, right? But that, it's understanding of, people see 3 things or 4 things. It really aren't a lot of things. Floss for a minute. Instead of your one toothpaste, just use ClinPro instead. Instead of using your Listerine or Scope or whatever useless product that you usually use the Paradex or the OxyFresh. So in closing, we just really wanted everyone to understand that a patient really needs to understand the importance of them having periodontal disease, and that it's something that they can't take for granted. So we just want to be on the same page and be very clear about it. What are the big main takeaways from all this, Megan?
We just really want everyone in the office to be aware of, what gum disease is, because, a patient may ask anyone, well, what is this gum disease? So I think it's just important for every one of us to have a basic knowledge of it, so that, if a patient does ask, we can say, it's an infection. It's going to get worse. It's something that can cause other health issues for you or make health issues that you have worse. So I think if we all can be on the same page, with that, from front staff to treatment coordinators, doctors, assistants, hygienists, if we can all be on the same page with that, it's only going to benefit our patients and their overall well-being.
All right, heard from Megan.